So I wanted to give you guys a little context before I share this video with you. So if you remember, maybe a little over a month ago, I had posted some pictures with me going to the Phenomenal event. And I told you guys I had a really good time on that Saturday. Well, Tasha, the person that I took the picture with and also went to her event, the phenomenal event, she actually had an issue with breast cancer, it seems like. So I saw on the news a whole story about her and I recognized her from the phenomenal event. And so this is what this video is about. Her being a survivor of breast cancer. And it's so crazy. I mean, I know I don't know her, right? Like a friend or acquaintance or anything like that. That was my first time meeting her. But to me, it's amazing how someone can be going through something. And most of you probably already know that I lost two of my friends to breast cancer, my best friends, actually. And so you could see someone that's going through that. And if you remember, October is Breast Cancer Awareness Month. So it was the ending of October that I saw this video, and I said, you know what, let me just kind of video it because it could be something in there that could help someone. And that's what I'm always thinking about, something that could help someone else that may be dealing with what she was dealing with, or you might be concerned of a lump or something that you found and want to know what your next step is. And by the way, if you guys never checked out my video when I did my mammogram, check that out as well. I went through the steps that I went through that day, also showed the machine that they used for a mammogram as well. So you might want to scroll down and check that video out as well. I'll go ahead and put the link in the description box as well so you guys could check that out. But stay tuned.
Sister just heard these words, and she was very kind, very patient, very gentle. She was really gentle with my mother, understanding she had just heard this twice now. Her bedside manner impeccable, but also she allowed me to really talk about what I was going through, how was I feeling before she just rushed to talk about treatment. She really cared about me as a person, and I felt that was the best. And it allowed me to build that no like trust factor with her. Yeah. And yeah, she's the best. So important. And Dr. Bora, what do you suggest in terms of women who are out there listening to this? Maybe they don't have the BRCA gene, but definitely get tested if you do have family history, right? But how early do women have to stay on top of this and get tested, mammograms?
I'm so glad that you asked that question. So, yes, not all women have the BRCA gene, but every woman. What's really important is at the age of 25 to 30, you meet with your physician and go over your clinical history, family history, and based on that, your physician will come up with a personalized risk assessment. So, for the average woman, and this is the average woman, not someone with family history such as Tasha, for the average woman, most societies do recommend starting mammograms as early as 40 years old now. And it should be done every 1 to 2 years. For women who have a family history of breast cancer or women who have had individuals in their family diagnosed at a very young age, your physician may recommend a slightly different screening protocol, and he or she may recommend that you have screening at an earlier age, sometimes as early as 5 to 10 years before the age at which your first degree relative was diagnosed. So, an individualized risk assessment is very important for the average American woman. If you have an average risk, 40 years old, please get your mammogram. In fact, I tell everybody for your 40th birthday, gift yourself a mammogram.
Book that appointment. Thank you so much for sharing your story, and we're so glad that you're well, healthy, and everything is going well, and you're such an advocate for this cause. So thank you so much, Tasha and Dr. Bora. We'll be right back.
Thank you for having me.